I'm a registered herbalist and acupuncture physician here at Tradition School of Herbal Studies in St. Petersburg, Florida. I'm also a practicing herbalist and acupuncturist with acupuncture and herbal therapies. And now for a number of years, I've been doing a number of YouTube videos and Facebook videos. We give lectures all over the world. And for better or worse, one of the things, I get so many emails from people concerned about their own health or their loved ones asking for my help. And unfortunately, there aren't enough hours in the day for me to be able to appropriately help all the people in all of their oftentimes really complex medical concerns. So I came up with an idea. One of the things we've been working on for the last few years is really developing our YouTube page. So I hope that all of you love so many of the videos we've done on YouTube. And if you haven't seen them, please subscribe. There's a button right down there. But my plan is at least once a week to take one of these emails that I've gotten where people have asked me for help about a particular issue and do my best with the limited amount of knowledge to give some guidance on a variety of issues. So I'm going to do my very best to get a couple of those out, at least one a week. And it's an opportunity for you to kind of see my approach, to start some self-care in a lot of cases. And one of the problems is we never have enough information. There's nothing that can replace having somebody in your presence to be able to take their tongue, pulse, and ask questions as they guide you down a particular pathway. And intakes often take well over an hour, sometimes longer. And so the information I'm going to do my best to provide is certainly not complete, but it's a safe starting place for anybody. But I've got one just recently, and sorry for the airplane going overhead, I got one just recently that was interesting and also concerning. And so it's probably one that everybody should really take into account. I believe they were from South America, I forget which country. And their mother, her leg was acutely swollen, i.e. it got red, hot, and swollen, and it had happened very quickly. This isn't a good time for herbal medicine. This is a good time to go into a walk-in clinic, a hospital, or see an MD. There's a number of things that herbs are amazing for: dietary changes, supplements. There is no doubt we can do a better thing. But when we see acute injuries, broken bones, in particular, or very fast onset symptoms, especially when they're hot in nature. When you touch it, it's hot, their fever's high. That oftentimes is best addressed through the medical community, the Western medical community, that standard MD. And if it's colds and flu, up to a certain point, we can use herbal medicine to great success. But when a body part, for no apparent reason, changes color, either really pale, really purple, swollen, red, hot, or cold, there could be a blockage, a blood clot. It could be that there's a serious infection. And so I always encourage people, when there is a fever present and you can't explain why, they probably need to go to the hospital. So if there's constipation with a fever, go to the hospital. If there is a one-sided lymph node swollen with a fever that you can't explain, you should go to the hospital. And there's a number of other issues that, but fever with an unexplained cause, you need probably very fast medical intervention. The herbalist can clean up the mess after the fact. So there's a couple of subjects I know I've got coming up. I've had a number of questions about cancer. I wish I could cover that in 5 or 10 minutes, but I will definitely give some input on that. I got somebody asking about ADHD for a child, and I believe it was in Pakistan. I can definitely do some more information. I actually emailed them back already. And I'm sure I got a couple of other interesting ones in there that I've got archived that I may not have emailed them back yet. So unfortunately, my days are long and they go on 7 days a week, and sometimes those folks who are not my current patients do fall by the wayside, and I get back to them sometimes a month later. So we'll see if we can't do it here by YouTube. Please subscribe if you're in the area. Please join us for some of our free classes, our exciting Thursday night classes that are more metaphysical in their nature. We've got lots of